welcome to today's special event to recognise and celebrate the achievements of young professionals in the global eye health sector, and to launch this year's Eye Health Heroes programme, which is supported by the Allergan Foundation. I'm Peter Holland. I'm Chief Executive of the International Agency for the Prevention of Blindness. We're the overarching alliance for the global eye care sector. We've got members drawn from the NGO sector, from the corporate sector, eye hospitals around the world, academic bodies and professional institutions. The Eye Health Heroes programme recognises and celebrates the achievements of young professionals within the eye health sector from anywhere around the world. It's a year-long programme in which we offer the opportunities to connect, develop and support outstanding young eye health professionals from across the NGO, corporate, clinical and public policy global eye health community. And that's what we want to talk about today. And I'm absolutely delighted to be joined by four guests to really have a conversation about the programme and experiences on it. And firstly, we're really pleased to be joined by Her Royal Highness, the Countess of Wessex, who's been our global ambassador for IPB since 2003, and has been an incredibly committed advocate for eye health globally over the past 2 decades. And I'm also really pleased that we can be joined today by 3 of our current eye health heroes. Firstly, from Singapore, we have Maud Zeller, who's Associate Director for Regional Programming for Middle East, Europe and Southeast Asia for one site, for one of our NGO members. Secondly, from Mozambique, Mércia Cumalo, who's the Programme Manager for Sight Savers there. And Mercia has worked at Sight Savers in Mozambique for the past 10 years. And thirdly, from Pondicherry in India, Natarajan Vengadesan, who's the Patient Care and Quality Assurance Manager for the Aravind Eye Care System. So just to kick off, I wondered if I could just ask each of you individually in turn to just tell us a little bit about what you're working on at the moment. And Maud, perhaps we could start with you.
Yes, so well, I would say COVID-19 has certainly changed, the way we work. So my main role was actually to build programmings around the different countries outside of Singapore. With the closing of borders, that has enabled me actually to focus more on relooking at every program that we do across the countries more in detail. And I would say rethinking a little bit outside the box, how we deliver impact remotely and also through more partnerships. So I'm currently really focusing on that.
Brilliant, thank you. And Mercia?
Yes, thank you. I think it's almost the same situation with Maud. We work mostly in the districts, in the rural areas, community, essentially. And with this social distancing, etc., it's quite difficult for us to be doing the work we usually do. So now we are working mainly on revisiting our project documents. It's a kind of a desk review of how we've been doing the things and what we need to improve. We are focusing more in things that we were not able to do during the normal routine of work because probably we were overloaded. So we are looking more on quality of our services, like quality assurance documents, protocols. We are developing some protocols on quality, on inclusion of people with disabilities. And we are also strengthening our partnership with DPOs, BPOs, and other stakeholders working on disability to ensure that to advocate for inclusion measures that are taking place for COVID-19, against COVID-19, because we feel that they are left out, most of them. So we need at a certain point to be together with the other stakeholders and push the government to recognize that they will have different needs, so they need some strategy targeting them. It's still a work in progress. We haven't achieved a lot from now, but we are working on that. And we are also trying to work on procurement to get the things shipped from outside the country to here, So when we are released to come back to normal, we can have all the material we need to start working in full. So that's basically.
Great, thank you. That's really interesting. And Vengadesan.
Yeah. Thank you, Peter, for the introduction. So again, has everybody told, the new norm for us as Aravind Eye Care System, volume. This COVID has again, reduced our volume. We are just seeing about 1/3 of the volume that we normally used to see in the eye care. Are facing is even people with irreversible blindness like diabetic retinopathy or glaucoma who need to access eye care at this moment. So we are really working on taking eye care through our primary eye care centers to the community or through teleconsultation to reach more people. The work is on the new norms of the safety and the quality for the patients. Now one thing is patients are even also afraid to come to the hospital, the fear of COVID, getting into the hospital. So like we have designed the entire infrastructure in a separate way. And for me, this is a new learning, in terms of sustainability. I have been working mostly on environment, but now we can see, reducing the patient travel can be one of a major area that we have to look in. So these are the areas that I'm working on, getting people into the system, removing the barriers that are now, like we have this districts are shut down where the new police are not to healthcare system. So there are a lot of challenges that have been going on. We are trying to overcome all these challenges in a more sustainable way. So yeah, this is a new norm for us, and it's really interesting. New era of pandemic. Thank you, Peter. Yeah.
Great, thank you. Your Highness.
Yes, no, thank you very much, everybody, for giving us this picture of what's going on. I think it's clear, obviously, that the worry is that we're not necessarily getting to see and to treat people who have degenerative conditions, and we're not seeing them in the numbers that you would normally see them in, because either they can't get to you, or they're isolating for other reasons, or that they're not allowed out. So of course there's a certain amount of concern that the amount of people who will lose a lot of their sight, or lose their sight completely because they won't have been seen in time. There's a concern about that. But it's interesting how you're developing new ideas to get to see as many people as you can. And perhaps going forwards, it'd be interesting to see, once we're out the other side of the crisis, some of the benefits that actually there might be to have out of this. So whilst there's the worry to be able to get hold of as many people, because there's been so much progression in an advancement through the various programs over the years, that it's frightening to see that we're losing a lot of that ground. So obviously we all want to be in a position where we can catch that back up again. But moving forwards, I'd be interested to hear what kind of new strategies you might be implementing now that could actually play a positive role further down the line, if you can identify any of those.
I can share, I mean, we're still working on it, but one thing in one site, one thing we used to do in the past is we were able to send people from different countries around the world on a specific mission. Obviously, this is not possible anymore. So it has opened, I think, an opportunity. And I really see it as an opportunity, is how can we build a more global, what we call in our organization, an ambassador program, which would basically enable people to know about the cause, because not enough people know about actually eye health condition. People know about poverty, climate change, but we need more people in each country to be aware of access to vision care. So it would be to build that ambassador program that trains people on how they could actually be part of the impact and work with our local partners on the ground instead of us traveling all over the world. So we don't really know yet how this is going to be fully implemented, but this is something we're looking at, and I think to me it's an opportunity because more people would really know about the cause that we are all passionate about in this call today.
Thank you. Do you other two have any other potential pluses that might come from this?
One of the things that I think we have learned, or we are learning with this COVID-19, is the issue related with cost effectiveness. Like we can do some economy in our activities. We used to have a lot of trips for people to change experience, for meetings, things like that. So with this that happened now with the COVID, like we are using a lot of electronic platform, virtual, it's possible to save more money for what is really more useful or more important, which is to provide services to our patients. The other thing I think is not like a strategy, but is an opportunity we are seeing here. Like with all this campaign on washing hands, etc., that is going on, maintain the hands cleaned, etc., we are seeing an opportunity to add on this and put there a face washing also in the schools, because I believe that after the COVID, all the infrastructure that has been put in place to improve hygiene, etc., and sanitation will be there. So we just have to use it in favor to eye health, to promote more eye health, more health eyes. That's it. Thank you.
I think that's absolutely valid, because certainly in the countries that I've visited through IAPB and Queen Elizabeth Diamond Jubilee Trust, you know, and Orbis and things, I've seen so much, so many issues being caused by lack of hygiene, and of course, then when there are programs that have combined with other organizations, whether it be Sight Savers and you know, and WaterAid, for instance, you know, the effect, the effects that it has on the reduction of some of these eye diseases is dramatic. So I think it's an incredibly valid point that actually, hopefully, with some of these simple measures, that actually it will be, you know, in another 10 to 15 years time, it'll be interesting to see the figures, to see how much impact these measures may have had on the ground in terms of reducing the impact of some of the more prevalent, but you know, prevalent eye conditions that exist in some of the nations around the world. Yeah, that's really interesting. Simple stuff like this right now, which you take for granted, that, you know, we're concentrating on a virus, but actually this is going to have a good effect for other reasons on things like on eye conditions, which is a positive. Yeah, I think we've lost our other.
Yeah, unfortunately, I think Vengadesan had some connection issues. They had a downpour just before we started in Pondicherry, so I think that's affecting the connectivity. Hopefully, he'll be able to join us again.
That would be good. That would be good. Both of you also you won the award as Eye Health Heroes, and so what kind of things have you been able to do with that award? Has it meant what's it meant for you?
For me, I would say it meant a recognition of what I've been doing, because I think I am passionate with eye health, or with the work I do. I really like the results of my work. So it was kind of a recognition, and I use it, probably I would say, to motivate others, my team members. Like, okay, it's an award, but it's good because it shows how valuable you are, and it shows how your contribution is making difference. So if we can all do the same, we don't know if we will ever, we will ever get an award, but at least if we can have that sense like, yes, I've done my best and I'm doing something that is making a difference in the world. I think that's the best sensation that anyone can have in his life.
Yeah.
So for me, that's it.
Thank you.
I would say I join you, Mercia, on what you're saying. I'm also, I'm very passionate about it's probably the most rewarding job that I do is the one that I do currently. So being able to have an award on something that you are so passionate about and excited about when you wake up every morning, I don't feel like I'm working. I'm actually thinking, okay, how many more lives can I impact today? So having an award in that kind of context is very, very rewarding. And like Mercia, you say, I think it's, I also use it to inspire others. Then, you know, you have to see everywhere there's an opportunity. And if you do with passion, some people, you know, it can work. And on top, you can be recognized to it. So keep going.
Yes.
Well done. And since you both came into working in eye healthcare, what do you think has actually has much changed for good and not so good? Do you think much has changed? Do you think there's more awareness, or do you think it's getting harder? And particularly now with COVID-19, do you think we've taken a backward step, or do you see that actually things are still continuing as they should be?
For my country, I would say we have gone a long way in eye health. When I joined eye health, it was really I would say, in bad shape. There was no eye health at all. It was like, for example, in the province where I work, we had 4 million people, and we just had 1 ophthalmologist and 5 ophthalmic technicians for 4 million. So we can see that the difference was too big, according to what IAPB has recommends for eye care staff in Africa. So since then, we have been working, doing an advocacy work for more recognition of eye health in the country. And I think it's paying off because now we can say that we don't have the right numbers of ophthalmologists in the country, but at least in Nampula now we have 3 ophthalmologists. Of course, it has been 10 years, but there are 3 ophthalmologists. We have more than 47 ophthalm technicians, which shows an evolution. In the past 2 or 3 years, the optometrists were recognized because they were not there, and they are doing a valuable work and releasing some staff from the ophthalmologists so the ophthalmologists can concentrate more on clinical aspects. So we have improved a lot. We didn't have, like, our indicators were not in the national HMIS system, but now they're there in the past 2 years. And many things. We were not receiving absolutely anything from the government for eye health. And in the last 4-5 years, I would say things started changing. We have been receiving very sporadically, but at least we are there. They know that eye health exists. They need IOLs, they need consumables, they need equipment. So I think things have changed, but sometimes it's also, I would say, I'm not sure if that's the right word. English is not my first language. Deceiving or deceptioning, because sometimes you go to a meeting, you go there for advocacy, and instead of them saying, yes, we will provide, they turn to us and say, yes, but you are NGO, you should provide, you should help us to provide this, to improve this. Yes, I should, but I've done from this 1 point to 0.6, and now I have no more resource to do to 0.7 or 8. So probably the government now should come in, and sometimes they say, no, we don't have money, and you know that. So sometimes we have these back steps, but I think things have changed, and we should appreciate that they are changed. It's a baby steps, but they are changing positively. Now with the COVID-19, probably we are stuck because everything now is COVID, even malaria, HIV, it's like they don't exist, which is also wrong, because I think the health system should be capable to provide equal services for everyone according to their needs. Not saying, okay, you don't have COVID, so you don't have bed. This one has COVID, so he has right to bed and all other equipment. But probably when the COVID ends, we will come back to the normal way of work. Sorry, I talk too much.
Thank you. No, that's great. Thank you.
I would add that for me, something that I've seen that has really personally really helped me my everyday job, especially when it comes to trying to explain to people who don't come from the eye care world how complex the vision care is and what needs to be done, is the WHO report that was launched recently with IAPB. That made a significant change in what I do, because suddenly you have a document that is tangible with data and explanation of how to articulate the problem. And I think this was really helpful in order to, when you are going to advocate or when you are going on the field to talk to different partners who value vision care, they know that this is something as part of primary health care, but unfortunately, due to lack of resources, they can't always support that. So in order to help move to the next level, such information really helps shape help have a global vocabulary or global story on how we can all communicate as an organization in the same way. So for me, this was helpful and really a milestone, because it shows it's something that is recognized globally and that needs attention.
Vengadesan, welcome back. I know you've been having some connection difficulties, but it's great to have you. The Countess was just asking whether essentially the kind of challenges you face, particularly in the context of COVID-19, and whether you see the priority and profile of eye health being maintained.
Yeah. I'm sorry about my internet connectivity. Yeah. So to answer your question, I think very much now COVID has really impacted the eye care in our scenario. One thing is a lot of things are happening. The corneal eye buttons for corneal ulcers, and on the other hand, we have ulcers, going to the next stage where patients are not able to get the eye drops. So I think that will, that impact, I don't think we will see it now, but I think it will have a greater impact in the coming years. It might be, the progression of diabetic retinopathy or the progression of glaucoma, which is going to create increase the burden. Where even me as a team, we are really working on, how we can really help people. So to do a lot of community outreach before, but now we are trying to see how volunteers can help in bringing people to the healthcare system. So that is one thing that we are trying to do. And another important thing is how decent, that is where we are trying to work on the healthcare delivery. So the primary eye care level to identify the posterior segment problems, patient with some kind of an urgent letters to the. So the major challenge that I see is the burden might increase. The lockdown still increases more, but now at the current, the access for healthcare has been open. What the scenario is. And the third thing is, again, we as an organization, Aravind has never thought about bilateral cataract surgeries before. Considerations, we are also thinking about these opportunities, reducing the multiple travels to the patient. So now this again gives a different approach for health delivery, to think out of the box, what we have not done before. Can this be a solution for that? So a lot of things brainstorm sessions are being going on towards this part to take eye care delivery back to the community. Yeah.
I think going forward, that's going to be really important, to be in a strong position to try and develop new strategies when at the end of this, you know, we're able to sort of try and get back out there again. So if any positive things are to come from this whole situation, it's in what can we do better and more efficiently, and as you say, reducing the requirement for people to travel quite so much, because actually, as we know, there's a lot of people in and around your countries and regions that find it very, very difficult to get to the locations that they need to get to for the right kind of help. So it's a question of trying to think in a different way, think from the other end of the telescope, perhaps, to see what where that's going to take us. It's challenging times, but it's such a shame, because having been involved with eye care for, gosh, I mean, Peter, you're saying, gosh, it really 2003. Extraordinary. That when Vision 20, that's when IAPB and Vision 2020. But we've come such a long way in that time. I mean, certainly, and then with the help of the Queen Elizabeth Diamond Jubilee Trust, which has been so effective, particularly across the African continent, it's been wonderful to see that, and it's heartbreaking in a way to see some of that effort, you know, not carrying on. And for the moment, I hope this is going to be a temporary moment that actually we move on from, because we were making such great strides, hugely positive strides, and particularly with different governments recognizing that they have to do better when it comes to actually helping to provide more support to the eye care sort of, you know, the infrastructure. But so yeah, I'm really hoping that we do manage to move forward, but we're going to need all of your help to think of new creative ideas, which, yeah, it's work in progress, clearly.
What I'm hopeful of is that with the COVID-19, there's people realize that it's important to help each other. I mean, we say it, but it doesn't mean we always, you know, I would say do it. And we've seen so many people helping each other in different ways. So personally, what I'm hopeful of is all these also companies that may look for, you know, strengthen their corporate social responsibility, and they want to support more of a cause. I hope that, you know, they think of vision care as well, because we need also their support. So I hope that pandemic is really enabling people to be more open to their own community in their backyard, as we say, but also don't forget the rest of the world.
Other thought from my end is, what would be the priority? You know, economic burden being a big problem now. You know, now economic has been hit down very high. So the question that runs in my head would be, what will be the priority for eye care among the people with no? You know,
that's a very big worry. I think it's a very big worry for all sorts of NGOs and charities around the world right now. You know, everybody is a bit of a collective holding of breath, because we don't know what the impact is going to be. Certainly in the UK, we're beginning to hear and feel a bit more of the impact that COVID-19 has had on businesses. We don't know economically, really the full impact of what this is going to mean on people's ability to continue to support charities. So yeah, I mean, Peter, maybe have you got a better idea of what's the impact that's being felt from that side of things yet?
Well, I mean, I think a lot of what everyone has said is what we're seeing. That we do know that it's impacting people who find access more difficult are finding finding access more difficult. And some of the immediate responses and some of the innovative responses, for example, using technology in new ways to reach people, which is quite exciting. One of the risks there, of course, is you access people who have access to that kind of technology. So the technology we're using here, and so again, you leave behind people who live in rural communities and don't have access to that. So so I think that's right. I mean, equally, I think the sorts of things that Vengadesan was talking about actually beginning to think more imaginatively about the way that you practice, actually reaching out into the communities directly, and really putting a big emphasis on primary care. And I mean, I think all of your organizations, that's very front and center in terms of what you're thinking about. And when we talk to our members, that's very much at the sort of center of what they're thinking about. So I think people are very alive to it, but I wouldn't want to underestimate the challenge in terms of doing that. But I do get a real sense of determination that people really want to make sure that they address that, and we don't leave people behind in that process.
I think there's also a worry about, certainly from some of my organisations over here, whether they're involved with disability or particularly vision care, that certainly for people with low vision or no vision, a lot of them are sheltering, or they don't feel confident to go out. And of course, with the new measures, and I don't know what it's like in your areas of the world, but of course there's lots of different measures that are in place for going into shops or just going anywhere. And they don't feel comfortable or confident about going out necessarily. So, you know, I think there's going to be a lot of people who are still isolating right now, or don't necessarily need to isolate, but they are just not confident to be able to come out. And if you don't have any sight, then it's, you know, I worry that they're going to become lost in the system completely. And if we don't get to see them, if people aren't aware of them, that they will go behind closed doors and not come out again. And I think there's a real worry about that happening. I don't know, maybe you can tell me whether or not you feel you're starting to hear similar things around the world.
Mercia, I know you were talking about the impact on people with disabilities at the beginning.
Yes, I think one of the things it will be surely the isolation, the increasing isolation that will be for people with disabilities, even after the social distancing has been removed, etc. But the other impact is increasing in poverty, because some, although they have some disability, some they still do some kind of business, selling in the market or whatever things they do to earn some money, but now they can't do it because they are not confident enough to go out their homes and go to fetch for food for themselves. So I think the increase of poverty is one of them. So these people will need more support from us, from the NGOs working in the areas of I would say social responsibility, etc., to support them. This will be one of them. The other one, I would say, probably increase of disease among people with disabilities, because if they don't, even now, if they are not having enough health care that they would need, it means by the end of this period, they might be worse, or their condition, if they have any treatable condition, might get worse. And when they go to the hospital, it might be a little bit later to cure that or not. We did a study last year, for example, it was a RAB, and it showed that for people with disability, the access to eye health, it's more difficult than people with not disability. And if they are poor, or the poorer they are, their access is even worse. So which means, I think now is the same situation, but not only for eye health, but for the health in general. So if we look at that, they have disabilities, they are becoming even more poor than they were before, so their access to health will be even less, and they will have they'll probably have more health problem than they were supposed to have.
Yeah.
That's been a great conversation, and for me, I mean, a lot has come out, and these are all challenges and issues that you're confronting on a daily basis, and I know the sector is confronting across the board. I mean, I think for me, there are some grounds for optimism. I mean, it is really challenging, but I mean, I would echo what Maud said about the World Report on Vision. We have a framework now which does give us the basis of talking to governments in consistent ways, and that's really helpful. And that builds on, Your Royal Highness, what you've been saying about the experience over the past 20 years and the experience the sector has got and the progress that we've made in that time. And you've all mentioned ways that you are innovating now, and that I think there are green shoots there, that optimism. And frankly, the three of you are great examples of why we should be optimistic as well. That it's people like you who have, with the passion that you've got, that are really ultimately, that's what really is going to make the difference for us. And that's so it's great, and it's great to have had you here. I need to launch, and I want to launch this year's iHealth Heroes Award. Just as I do that, I wonder if I can ask each of you for just a sentence as to why you should nominate someone for an iHealth Heroes Award. So if I could just go around, just one sentence on why you should nominate. Maud, what would you say?
So you can, if that person inspires you, she will inspire others. So that's why you have to nominate.
Right. Mercia.
Yes. Okay. She stole my answer.
Sorry.
I would say okay, just to change a little bit, I would say if that person is a believer that we can have a better world with better eye care services, we should nominate that person. It's a believer and does something to prove that it's possible. Brilliant. We should nominate that person.
Thank you. And Vengadesan.
Yeah, that would be great. The one thing is from my thing is bringing out new ideas in a local bodies, sharing it with a lot of people. That's the key. What even Mercia doing work there, bringing it to a larger and where people come to know about what they are doing. So it's most a single line to showcase an individual boundary to a bigger boundary.
Brilliant. Well, I mean, you're all three of you fantastic adverts for the iHealth Heroes Award. So thank you so much for joining us today. So we're launching this year's iHealth Hero Award for 2020. This year, we're especially recognizing people who've done inspiring things, particularly during the pandemic and during the global COVID-19 pandemic. But it's a year-long program, as you know. It's a program intended to connect our heroes together to develop and support you over that year. You'll have opportunities to take part and lead global discussions like this one. And there will be a whole range of other opportunities, for example, to connect and get support and advice from leaders across the sector. This year, and this is the first time we've introduced it, there are going to be 3 award categories for change makers, innovators, and leaders. I suspect all 3 of you would have probably qualified under all 3 of those, but those will be the categories this year. There's a link which will be underneath this recording where you can nominate, and there's a link on our website for nominations for the award. So it would be great if we could get as many nominations as possible to join Maud, Mercia and Vengadesan as iHealth Heroes for 2020. And I would particularly like now to just thank Maud, Mercia and Vengadesan for joining us today, and particularly Your Royal Highness for sparing the time and joining us as well, which has been a great event for us. Thank you.
Thank you, Peter, and thank you to all three of you as well. Thank you for what you're doing for the many people who need the support and services that you're providing. Thank you so much, and thank you for being such great ambassadors for the eye care health industry. It's you know, you're all amazing, and I would encourage everybody to put forward lots of nominations for the awards. We need more amazing people to be doing amazing things in this world, and you're great examples. So thank you very much for everything you've done, and good luck to everybody else that's going to be nominated. And thank you, Peter, for having me here today.
Thank you. Thank you very much.
Thank you too.
Thank you.
Much.
Thank you.
Yeah.
Bye-bye.
Thank you.
Bye.